The US Senate is working on their version of the big ugly bill, which would cut $1 trillion from our healthcare to pay for tax breaks to the rich. Welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202-838-6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get the next show. In today's episode, healthcare expert Adam Hoyer from Protect Our Care returns to give us the latest news about the budget bill and how these healthcare cuts could affect you. So, welcome, Adam Hoyer, National Organizing Director for Protect Our Care.
Thanks, Laura. It's great to see you. Great to be with you. Always appreciate you having me on. And yeah, I will give sort of an update on where we are now. But of course, it's a fluid situation. I should note that this update is coming on Monday afternoon, on June 16th. Things could change, and things probably will change. We're already hearing that we're about to get some text of the bill out of the Senate Finance Committee, and once we have that, we'll have a little bit more to work with. But we've seen some drips, so we kind of know what to expect. And if I could, I might just take a step back on the timeline real quick. So just before Memorial Day, as you may remember, House Republicans passed through reconciliation the so-called One Big Beautiful Bill, a very large, sweeping piece of legislation that was primarily designed to give tax cuts to the very wealthy. That bill passed by exactly one vote in the House of Representatives. Every single Democrat voted no. All but a few Republicans voted yes. A couple of them conveniently slept through the vote. And you may also recall that House Republicans did virtually every aspect of this process in the middle of the night, including its final passage. And many of those who voted for it even acknowledged that they themselves didn't read it and didn't really even know what was in it before voting yes. Some of you even sent a letter opposing the very bill that they themselves voted for. So now the bill moves on to the Senate, which is moving it through their slightly different, slightly weirder, much slower process, but with the hope of still getting it passed and signed before the 4th of July, as President Trump requested. So it's currently going through a process known as the bird bath to ensure that all aspects of the legislation comply with the specific reconciliation process. I don't think there's a need to get into the wonkiness of that. But we're also, as I mentioned, awaiting final text from the Senate Finance Committee, which oversees both the tax provisions in the bill as well as the healthcare provisions. So this is a biggie. This is an important one. And as I said, the text should be coming any minute, potentially into this evening. But reports are that it won't waver too much from the House version of the bill. It certainly won't be any moderate from all things that we're hearing. And in fact, they may be rationing up some of the cuts that they were considering in order to appease some of the fiscal hawks among Senate Republicans. Anyway, Republican leadership appears to be on track to get their version of the so-called Big Beautiful Bill onto the Senate floor by the middle of next week, potentially starting Votorama on Wednesday or Thursday, with the hope of getting passage before next weekend. And if the Senate gets it passed, and of course they only need a majority of senators, the House and Speaker Johnson then would have a choice. They could either stay over the weekend next weekend and vote it through their chamber quickly, or they could come back the following week to still get it done before July 4th. Or if the changes that the Senate incorporates are just too hard for the House to pass, and as I said, a lot of them have already expressed some consternation over what they themselves passed, then they could just use the entire month of July to negotiate behind closed doors, get something that both chambers are happy with, and get something done before August recess. So that's sort of where we are on process. And as I mentioned, the House bill moved so quickly that it wasn't really given the full, thorough deliberation that you might expect for a piece of legislation this large and this consequential. And in fact, the nonpartisan Congressional Budget Office wasn't even able to complete its analysis of the bill until after the House passed it. But we do have that now, and the CBO has said that the Republican spending bill will cut over $1 trillion from Medicaid and the Affordable Care Act. And it'll cause 16 million Americans to lose their health coverage, and it'll cause millions more to see their health costs go up significantly, and all told will increase the uninsured rate by more than 50%. That is a whole lot of bad, and as I said, it could even get worse when we finally get Senate finance text. How's it going to do that? It's primarily going to do all that horrible stuff by rolling back Medicaid expansion and ending the premium tax credits for people who get insurance on the ACA marketplace and imposing so-called work requirements for Medicaid and SNAP beneficiaries. And I say so-called work requirements because they do not do that. We've tried them in places like Arkansas and Georgia, and they've essentially just amounted to nothing more than paperwork requirements. It involves a lot of tedious red tape. It involves an ambiguous application and renewal process. And it involves an antiquated hours requirement system that really screws over people with part-time work, people with delivery jobs, people with gig work, and ultimately it doesn't effectively incentivize working. It also has some really disastrous potential impacts on hospitals and state budgets. As written, this bill would cut hundreds of billions of dollars in critical funding for hospitals. It would bury hospitals under the burden of uncompensated care, and it would force hundreds of hospitals to close their doors. We at Protect Our Care out with a new report that shows that about 330 hospitals are at risk of closing if this bill passes as written. And it would also shift a lot of the healthcare costs to states, which are not prepared or equipped for such a huge liability in their budgets. And as a result, a lot of those states are going to have to make some really tough decisions about having to make cuts to education or food services or their own health programs, or likely some combination of all of the above. So listen, this is all things that Republicans know as they're deliberating this bill, and this is the challenge that they face and always knew that they were going to face. The point of this bill, as I mentioned, is to get those tax cuts. That's what leadership wants. That's what the president really wants the most. And Republicans are almost certainly going to find a way to get that done. But those tax cuts are, of course, really expensive. They're going to cost a lot of money in the form of lost revenue. And there's no way to offset those costs without doing some really painful and unpopular cuts. So they have to figure out, for them, the least painful route to get those tax cuts done. And one thing that they have figured and are weighing right now is, for lack of a better way to frame it, whatever they can get away with. And they've picked Medicaid first because it's a big expenditure. And unlike the other two big expensive health programs, Medicare and Social Security, which mostly involved the elderly, people in Medicaid largely don't know as much about the program that they rely on as those on Medicare and Social Security. And additional conservatives have long crafted this narrative that Medicaid is fraught with people scamming and gaming the system to get a free handout, people who are able to work but are unwilling, too lazy. This is a huge, huge myth. Are there people receiving coverage through Medicaid who should not? Yeah, probably, but not nearly on the scale that they would need in order to offset these tax cuts. So Republicans are going to cling to the talking point of waste, fraud, and abuse. You've probably heard it time and time again. But there are many other ways to actually cut waste and fraud, including, oh, by the way, through Medicare Advantage, that they are not willing to touch. They're not going to go after. So they're going to go after Medicaid, and they hope that the affected people won't notice. And so on the actions front, and I'm an organizer at heart, I'm not a policy person, I'm not a comms person. There are a lot of opportunities right now. This is a crucial moment of inflection. As I said, they're trying to weigh how many cuts they can get away with. And the quieter people are, the more they're going to be emboldened to cut. And I think we've already seen, when they try to trot out these waste, fraud, abuse talking points. We saw a town hall with Joni Ernst when confronted with, the very real fact that people are going to die if they enact these cuts. And she tried to brush it off by saying, well, we're all going to die. The backlash to that was significant and frankly deserved. But I think it's telling. I think a lot of these members kind of want to float these talking points as trial balloons. They want to see, is this a thing that we can get away with? Can we talk about cutting Medicaid in the frame of waste, fraud, and abuse? And will people accept that? But what we found out, not just through anecdotal evidence like that, but also through polling that we and others have done, the more people learn about Medicaid, it's a really popular program already, and it gets more popular the more you tell people about what it is and who it affects. And the most unpopular thing that we have tested is cutting this in any way, especially through the work requirements that are just another bureaucratic measure to kick people off of healthcare that they need and deserve. And of course, there's a lot of actions taking place. There are a lot of days of action and weeks of action. There was, of course, the No Kings rally this past weekend, and that took on a lot of different causes, including these proposed healthcare cuts. There's a national day of action this Wednesday, June 18, specifically to protect basic needs like SNAP and Medicaid and the Affordable Care Act and more. Congressional Democrats, for their part, have marked this week as a week of action to specifically address the harm that I mentioned earlier that would be inflicted on hospitals as a result of these proposed cuts. And hooks like that are always helpful because it allows many voices to be heard all at once, and it helps garner attention to the greater cause. But really, every day is important. Every week is important. Every action is important, especially because we have three crucial audiences right now. One, members of Congress first, who need to hear from their constituents and others, since they're the ones considering these cuts, and they have the ability to take them off the table before they even vote on it. Two, members of the media, because right now there is a lot going on in the world, especially in the world of politics, and there's a lot that they can write about, even when it pertains to this bill. But we want to make sure that they're also writing about the consequences of healthcare cuts. And third, regular people are an audience right now because, as I said, most people are not aware of what's being considered. They're not even aware of how it might impact them. But when they learn about it, they're mad and they get active. And sometimes in organizing, it's difficult to see the forest for the trees. And it's difficult to believe that any one single action is actually going to stop these healthcare cuts from being enacted. It's easy to ask, is this one call going to make a difference? Is this one going to this one rally going to make a difference? Is this one letter to the editor going to make a difference? But if you've ever done organizing, or if you ever worked on a campaign, or if you remember the Affordable Care Act repeal fight of 2017, you may know or have heard the adage that it takes 7 different contexts to move someone to action. So you never know what that tipping point is going to be. John McCain gave the famous thumbs down to ACA repeal in 2017. But what about the other senators who voted no before him? What about, maybe that 1,000th call from an Alaskan is what tipped Senator Murkowski to be a no. Maybe that meeting with the West Virginia with pre-existing conditions is what convinced Joe Manchin to be a no. Maybe that letter to the editor in the Bangor Daily News is what tipped the perennially concerned Susan Collins to be a no. You just never know. But I am sure that when it comes to this fight, more is more. Even if you live in a blue state with nothing but Democratic electeds who have all committed to already voting no, it's worth urging them to take a stand and be a healthcare champion in this fight. Because there's a lot going on right now in their world as well. There's a lot to oppose in this bill, but the healthcare cuts are going to cost people their lives if we don't get them out. So we all need to be sounding the alarm bells until Republicans in Congress and in leadership decide that it's just too painful for them to leave this in the bill and force a vote on it.
Thanks, Adam. And I just want to make 2 points based on what you said. First of all, I think people may have a misunderstanding about Medicaid, that it's, giving somebody some sort of benefit when what it is providing health care. So you only get health care if you need health care. And if you take health care away, you have a sicker person that is not going to be able to work and caregive and maintain their education, go back to school. So any money that they save from Medicaid, which they are taking from people, not from providers, what they're saving on is taking healthcare directly away from the people who need it and are using it now.
Great point.
And why are they doing this? I mean, this bill blows a hole in the deficit. So people in Congress can't even say that they are taking care of the deficit. They're making the deficit worse. So they are taking away health care from people and costing taxpayers, future generations, trillions. Why? They don't have to do this.
It's a great point. And as I said, the main purpose of this bill is to give tax cuts to the wealthy. It is a thing that the president cares a lot about. And a lot of these members, frankly, are afraid of the president's and his bully pulpit. If they don't give the president what he wants in terms of tax cuts, they fear primary challenges. They fear constituents that the president can activate. And, to your point, even with these terrible cuts, they still don't offset it enough. It's still going to blow a hole in the deficit, but they're stuck between a rock and a hard place, and we just need to make sure that the hard place on cutting Medicaid is more painful than the President Trump rock.
Well, thank you for joining us, Adam, and keep fighting because we need to protect our care.
Back at you, Laura. Thank you.
And now I'm welcoming Louise Norris of healthinsurance.org and Diane Archer of Just Care and Social Security Works to answer your questions. Let's start by talking about what's happening on healthcare and public health, what has happened in the past week. Diane? Diane, there you go.
Yeah, right.
So what's happened on public health in the past week?
One big thing that's happened that is causing deepening concern about RFK Jr. are his actions as head of the Department of Health and Human Services that are not only misleading Americans about vaccine safety, but could endanger the health of millions of Americans. So last week, what RFK Jr. did was he fired the entire panel of 17 medical and scientific experts who serve as members of an advisory committee to the Centers for Disease Control. And the reason that is very concerning is that these experts are charged with making evidence-based recommendations as to which vaccines people should get, which people should get them, and how frequently they should get them. And what RFK Jr. is doing is replacing these experts with people who have little expertise and who do not support vaccines. A couple of them have been involved in lawsuits that are actually opposing critical vaccines. After passing an emergency resolution after these firings, the American Medical Association has asked the Senate Help Committee to investigate the firings. And in a letter to the chairman of the Help Committee, Senator Bill Cassidy, Senator Bernie Sanders, who's the minority head, asked for an investigation into these firings. Cassidy has expressed concern that these new members will be suspicious of vaccines, yet not really know much about them. And I want to add here that if these 8 new members don't recommend that people get certain life-saving vaccines, the consequences could be dire, because when it's as a result of these recommendations, of the recommendations of these members, that insurers decide whether to pay for vaccines. So Medicare, Medicaid, and corporate health insurers for working people will supply people with vaccines without any copays, entirely for free, sometimes because this advisory committee recommends that these vaccines are so important. But if they're not recommending these vaccines, Americans may be stuck having to pay the full cost of these vaccines. And a lot of them may end up not either being able to afford them and not getting them. And that could cause severe outbreaks.
Thanks, Diane. And a question from our viewer, Susan, who wants to know, what about long-term Medicaid for the disabled? How is this budget bill going to affect that? Louise?
So there are a few important points to keep in mind when we talk about Medicaid for people who are disabled. Throughout this whole process with the budget bill, you've heard Republicans in Congress talk repeatedly about how they want to protect Medicaid for vulnerable populations. And they do tend to include disabled people when they're talking about vulnerable populations. They're referring to children, pregnant women, the elderly, and disabled people. But the problem is nothing in this bill funnels more money into those groups. There's nothing it's not like they're taking Medicaid away from some populations and giving better benefits or strengthening the program for these, what they consider vulnerable populations. They're not doing anything like that. Cuts to Medicaid are cuts to Medicaid. That's the sort of the crux of the problem, is when you have, when states are looking at significant funding shortfalls for their Medicaid programs, which is the goal of this bill. I mean, they are looking to cut money that the federal government sends to states to fund Medicaid. So states are going to have to figure out a way to make that work. States do not have the money on their own to make up those shortfalls. So they will have to cut Medicaid in various ways. And there's certainly nothing that says that's not going to be people who are disabled. It very well could be. And another really important point to keep in mind is that although a lot of the Medicaid cuts in the bill are aimed at the Medicaid expansion population, which that's your low-income adults who became eligible for Medicaid due to the Affordable Care Act. So they don't necessarily have children. They're not disabled. They're low-income adults under the age of 65. A lot of those folks actually are disabled, but because the disability process it takes a long time, it's challenging. There's a lot of paperwork. There's a lot of hoops to jump through to get, technically certified as disabled. And there are also asset tests when it comes to Medicaid for disabled folks. If you're disabled, Medicaid is available based on your income, but also your assets, whereas Medicaid expansion is just based on income. So there are certainly people who are disabled who have Medicaid as a result of the Affordable Care Act's Medicaid expansion. And if these budget cuts go through, where they're targeting Medicaid expansion a lot with things like work requirements, funding cuts, absolutely people who are disabled would fall through those cracks and lose their benefits. There's also issues of whether providers, can stay open in some cases, especially rural hospitals. In that case, like if the hospital in your rural community closes because of Medicaid funding cuts, that's a challenge for healthcare for everyone in the community, not just people who are on Medicaid. So it's very wide-reaching. I would echo what Adam was talking about the need to contact your lawmakers. Especially if you or a loved one are on Medicaid as a result of a disability, but also if you have Medicaid for any other reason, or if you don't have Medicaid and you're worried about, your local hospital closing, the uncompensated care costs being passed on to people who have other types of health insurance. It is very far-reaching, and it certainly will not just affect people with Medicaid.
Thank you, Louise. Next question is from BJ, who wants to know, what can we do to stop these Medicaid cuts? Diane?
Well, as Laura and as Louise and Adam have said, and you've said too, Laura, we need to be contacting our members of Congress and letting them know that this is not a good idea, not only because millions of people will lose their health care benefits who have Medicaid and their families will be hurt. Also, more millions of people with Medicare will be hurt. Hospitals will close, particularly in rural communities. Jobs will be lost. States will lose large amounts of income. The devastation, the domino effect, the ripple effect of these cuts is just enormous. And I think that hasn't gotten the attention it deserves. So again, contact your members of Congress to tell them you oppose these cuts. Do it once a day, every day. As Adam and Louise and Laura have said, you can't do it enough. We just have to keep letting our representatives know that this is not a solution and that this shouldn't, cutting people's health care and cutting jobs and hurting economies and hospitals is not a way to reduce federal spending. Members should focus instead on the waste and fraud and abuse in Medicare Advantage, where the Congressional Budget Office and other groups have documented that we are spending about $1 trillion more than we should be over the next decade as a result of overpayments to insurers, and those could easily be cut. And those cuts to Medicare Advantage would not be a cut to benefits at all. In fact, they would strengthen Medicare. They would bring down Medicare premiums because these overpayments are driving those premiums, both the Part B and the Part D premiums, ever higher. And they would also strengthen the Medicare Trust Fund by, I believe the number that I saw from the Committee for a Responsible Federal Budget was over $500 billion. So addressing the waste in Medicare Advantage is a far better option than pushing millions of Americans off of Medicaid. And we should all be letting our members of Congress know this every day, all day.
Thank you, Diane. Our next question is from Kristen on Threads, who said, today I got a surprise medical bill for thousands of dollars for a surgery and hospital stay that occurred over a year ago. The insurance initially paid in full, then said, oops, denied a portion of it and asked for the money back. Then the hospital appealed, then the insurance company was like, no. Meanwhile, I thought it was settled and I'd already paid thousands last year. This is, of course, United Healthcare. So, Louise, can you explain what might be going on and what they can do about it?
So without more details here, it's hard to say exactly why they've denied the claim. So I guess that would be my first recommendation is to, contact the health plan and get detailed rationale for why they are retroactively denying this claim. That can be appealed. Once you have the reason that they're denying the claim, you can appeal that directly to the insurance plan, and your doctor or the hospital that
I think Louise, keep going. Oh, you're muted.
Can you hear me now?
Yes, but you sound a little scratchy. Let me finish off the answer for you while you deal with tech. Always tech. So what Louise was going to say was keep track of any calls you make to hospital or health plan so that you know why they denied the claim. Reach out to the insurance department in your state and ask them for help. They may advise you to file an official complaint with the insurance department so they can get involved with addressing it. If your health plan is through a large employer, it's likely that the plan is self-insured, which means you'd reach out to the United States Department of Labor with complaints. These days, with government cuts, they may not get back to you quickly, but you could try the Department of Labor. In that case, you might also want to reach out to your employer's human resources department and ask them to get involved first and let them deal with the Department of Labor. It's important to understand that most of the time, patients sign waivers before receiving medical treatment, indicating that you understand if you're responsible for the bill if your health insurance doesn't cover it. And I've clicked through those notices when I've, checked in online for health appointments too. There's certain state and federal exceptions depending on the circumstances, but you can end up in the middle of a billing problem when insurance denies a claim. And that's why it's so important to be actively involved in the process. And good luck with fighting these bills. And I'm sorry that this happened to you. And our final question is from Emily from Facebook, who wants to know, why do they have money to have a big parade, but they have to cut Medicare, Medicaid benefits that a lot of seniors depend on? So Diane, tell us again why they're doing this, why they're spending money on things that don't matter and taking away healthcare from people that do matter.
It's a great question, and the answer lies in priorities. What matters to most Americans is having guaranteed affordable health care. And what matters to members of Congress and the administration, or certainly the majority of members of Congress and the administration, is tax cuts for the ultra rich and parades that are intended to promote the Trump administration. And they're allowed to prioritize what they prioritize, and it's up to us to vote for the people who we think are best suited to represent our needs.
Thank you, Diane. And thank you, everyone, for joining us today to learn more about the federal budget and their proposed cuts to our healthcare in this big, ugly bill. Please text or call in your health insurance and healthcare questions to 202-838-6837, and we'll answer them in future episodes. Join us in a couple weeks for Care Talk for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.